Hey guys, how are you doing today? My name is Dr. Rich. I'm the chiropractor and clinic director for Thompson Healthcare and Sports Medicine at the Tinton Falls location. Today I'm here with patient Dylan, and today we're going to go over silicone cupping for back pain. We'll talk about what it does, how we can apply it, and what conditions it can be used for. So with cupping treatment in our office, we have two different types of cups that we traditionally use. We have the traditional glass cups and we have the silicone cups. Now the glass cups are a little bit more intense with the suction, but due to the material, it's not as flexible, so we can't do as much movement with it. Whereas the silicone cups are a little bit more stretchy, so the intensity of the suction is a little less. But there's progressions with this, so we can treat a patient static, just like how we're treating Dylan right now, just laying on the ground, laying on the table. We'll have him stay like this anywhere from 3 to 5 minutes. Once we get that little response there, that little redness. The idea behind the cupping is, if you have a patient with pain, inflammation, muscle spasm, you'll have stagnant blood flow to the area. So the idea is to, and the science behind it, is to increase blood flow to the area. That'll allow the circulation to increase. So that what that will do is, so with increased circulation, you'll have increased blood flow, increased oxygen, which will help decrease the inflammation, decrease the pain. It'll decrease the muscle spasm, and then the patient will be leaving here feeling a lot more improved and pain-free. Okay, so we'll leave these on, and typically we want to see it get a little bit more red than this, so I'm going to keep these on for a few minutes. With cupping, the only contraindications where we might not consider it is if we have a patient with a new open wound, or if we have a patient who's on blood thinner medication, because they'll bruise a little bit more easily, so it might not be the best thing for the patient. So again, going back to the silicone cupping versus the traditional cupping, what's neat about the silicone cupping is we could be a little bit more functional with it. So a patient like Dylan who's progressing with his treatment plan, he's a little bit more athletic, we can actually have him stretch with the cups on. So Dylan, I'm going to have you just push forward. So by stretching with them on, this is just going to be a little bit more of a comprehensive treatment. It'll increase the suction to the area. It'll strip the muscles a little bit more just to get that blood flow, decrease the pain, decrease the muscle spasms. You can come back up, Dylan. And then we'll go like a side to side too. So some patients love the static cupping when you're just kind of sitting there, laying there. For some patients who want a little bit more out of it, we'll progress to having the cups on with some form of stretching or strengthening exercise just to get a little bit more out of it. So another progression is we can have a patient perform functional movements while they have the cupping on. So in this case, if Dylan's back bothers him with weight-bearing positions, standing and walking, we'll have him with the cups on. We'll have him go for a little walk. And the same concept, because he's moving with it, it's a little bit more functional, so it's helping strip the muscles. In this case, because he's doing something that's functional, that usually gives him a hard time, it's more of a neurological type treatment as well. Good, we'll just do one more. And it's patient-to-patient basis. I mean, if we have a patient who has pain with bending and lifting activities, we might have them imitate lifting a box, bending and lifting a box while they have the cups on, and vice versa. So I want to thank Dylan for being our patient here today, and I also want to thank everyone for watching. If this is something that interests you, talk to your provider about it. It is definitely something that you can try in the office as far as you're a candidate for it. And it's a great therapy to utilize to increase range of motion, decrease muscle spasm, decrease pain, and decrease inflammation.